So thank you very much, Shri R S Rajaramji and my colleagues on the panel and all my friends from FICCI. Last time I came to this hall was probably before pandemic, and this was in connection with the telecom, space where we were having lot of controversies relating to, Geo's entry and interconnects user charges and all kinds of things. This was a highly quite kind of controversial or highly debated issues at that point in time, and I remember having a very interactive and vibrant session on that subject. Today I'm happy to say that though I don't take credit for it, but I am happy to say that when I joined the TRAI as its chairman in 2015, the data was selling at the rate of 275 rupees per gigabyte. Uh, the number of 4G connections were very, very limited. In fact, there were no 4G connections, 3G and 2G. Today, the data is selling at the rate of 7 rupees per gigabyte, from 274 to 7. Today, India is consuming, every consumer is consuming on an average 17 gigabytes per month per user. The entire network is 4G. We have 800 million internet connections. We have 1.2 billion mobile connections. We have 600 million smartphones in this country. Just for a comparison, the data rate in America of the mobile phones is 12.34 US dollars per gigabyte, as against 7 rupees per gigabyte here in this country. So I take some satisfaction out of that, that we were able to, and India today has been one of the cheapest markets in the world, and previously people were afraid that there'll be only monopoly or duopoly. Nothing of that sort has happened. Telecom operators are doing very well. Now you have 5G coming. As you know, 5G has been launched in some of the cities of this country. The speeds are pretty good of the 4G also, and I think cheapness of the data can be gauged from the fact that today Indians are watching films on the mobile phone. I don't think there's any country in the world which is watching films on the mobile phone. So this is a great satisfaction, and one of the pillars of Digital India when it was announced in 2014 and formally launched on 1st of July 2015 was that we will have digital connectivity as the first vision area. Digital infrastructure as a utility to citizens. That was the first part, and that first part seems to have been completed. Of course, we still have a lot to go in the fixed line connectivity, which is required, and then 5G coming in, then fixed wireless access will also happen. So connectivity piece is actually quite settled piece. Now the second piece which was required was the software and services on demand, and that also we have done pretty well in the Digital India program. There have been lots and lots of developments. Also the soft digital infrastructure, which was which is another requirement, that foundational infrastructure in a digital world, uh, those things also have been done. So digital identity, for that matter, where every Indian has got a digital identity which can be plugged into any sort of application or any transaction. So whether using that digital identity and electronic KYC generated by Aadhaar, you can open a bank account, you can buy a mobile SIM, you can get ration from the fair price shop. All kinds of things can be done, many things which require identity proof, and this is a digital, so therefore you don't require any physical documents to carry yourself. So that's another aspect which has been done. Similarly, in the payment space also we have done a very significant amount of work. Imagine, we did last month we did about 7 billion transactions on UPI, and UPI transactions, as you know, are absolutely free of cost. There is no limit on the, lower limit on the money. So if I transfer 50 paisa to you, only 50 paisa will go to you, not even 49 paisa. So that's the kind of digital public goods which this country has created. And some of these foundational goods have also had their, fruits or their offsprings. So for example, electronic KYC is there. You have digital locker where you can store your documents, your degrees, your all kinds of digital, your health records, for example. The digital locker is there. Today in digital locker, we have got 5 billion records being stored. So that's one part. You have the electronic signature, digital signature on demand, which is what we call e-sign, whereby you can sign your document without even having a dongle, just by proving your identity, just by using your digital identity. So you have electronic consent artifact. Many things have been done. CoWIN is the latest example whereby we created a platform which actually accelerated to 2 billion plus in a matter of 1 year. And some of the attributes of these digital public goods are they are interoperable. So they are not really silos. They are, interoperable. They can connect to various kinds of applications. So for example, CoWIN is connecting to 150 applications: Make My Trip, Apollo Hospitals, ATM, whatever. Talk about any application, Infosys. All these applications are actually delivering the same services of searching for the vaccination centers, getting the appointment done, getting the certificates downloaded. All those facilities are happening. So openness, open APIs, open standards, even open source, interoperable, scalable. These are some of the, because you are building something for 1.3 billion, you are not building for a small kind of, persons. So that's something which we have developed. So I think India has really kept, in a digital space, we have really leapfrogged. The country has leapfrogged. And the Prime Minister's vision of the presence-less, cashless and paperless governance actually is happening. In a way, it's being realized. Of course, a lot of work needs to be done still, but this is something which has been achieved and we should be proud of that. I must also share with you that whenever we discuss these kinds of things and the architecture, people are really amazed. People in other places, they don't really believe that, things at this scale and then this kind of architecture could happen. And when we call up digital public goods, as you know, our Prime Minister announced that the CoWIN as a platform must be converted into open source and must be exported to countries free of cost. And we have already had agreement with Guyana, for example. There are multiple countries who are actually wanting to use it. Some countries are already using it without giving credit to us because it's open source. I mean, I don't want to name them, but many of these countries are using, because they now understood the overall architecture, and it's a free. It's on GitHub actually. It's a open source. So that's what we are doing. So the idea is that now India as a country feels absolutely confident to really get into other domains besides these horizontal domains. Why I say horizontal? Because payment is a horizontal utility, identity is a horizontal utility, digital signature is horizontal, digital locker. I mean, it can be used by multiple domains. Now comes the idea of using this infrastructure and these kinds of building blocks into a specific domain. And what could be a more important domain than digital health? The health is as you know, COVID has really been absolute disaster for the entire world, also for us. So the only good thing which has come out of the COVID is increased digitization, increased use of digital means. So we in COVID, when we could not go out of our house, we were calling the doctor, also doing video calls saying that साहब देखिए मेरा इतना बुखार है, ये reading इसकी oxygen level मेरा इतना है, what do I do? So this digital use of communication tools, that has increased during COVID. And I think the Honorable Prime Minister saw this happening in some sense on 15th of August 2020, when we did not have this, kind of stuff. The COVID had not as yet, it came in about March 2021, if I'm not wrong. No, March 2020. So in 15th August, he actually announced that from 15th of August we will have the digital, mission of the medicine, digital health mission in 6 union territories. So that way we had been, actually the conversation began in June of 2020, that this should happen. We should have the COVID vaccine will not come, but we will have this. We should have a health program. So that health program was actually announced by PM, and then from of course last September 2021, it was launched for the whole country, and now we are doing this digital mission in the health space, and we feel that digitization will result into a number of desirable attributes for health. One, it will make health provisioning more affordable. Why? Because using digital tools, you are able to reduce cost. You don't have to camp here in front of AIMS to wait for 10 days and then, or you can sit at home and do a teleconsultation. So it makes it more affordable. It makes it more accessible, because then now you don't have to, you can be in a very remote area and still you could connect using the teleconsultation, which is now very much popular. In fact, we are having 200,000 teleconsultations per day in this country. Even now, even only e-Sanjeevani figures are 200,000. There are many private, Practo, 1mg, many other people who are doing many more consultations. So that is one thing which has happened. So it makes it more accessible. Then it makes it also affordable, accessible, and then of course quality. Quality also improved because everything is transparent now. So these are some of the basic attributes which will happen. Second, India already has the enablers for these transactions to happen. So for example, the teleconsultation. Now teleconsultation, what do you need? You need to prove your identity, because doctor wants to be sure that you are the patient. Doctor's identity, because the patient wants to be sure that the person on the other side is a qualified MBBS doctor. You need to pay the doctor. Now digital identity provides that identity authentication. UPI provides the payment facility. The doctor gives a prescription at the end of the teleconsultation, and he is able to digitally sign using the digital signatures. This is e-sign. He doesn't have to give a fax or anything like that. He can just e-sign the document, and that document, as you know, legally is as sort of good as a pen signed document. So I think all these building blocks which can enable this transaction to take place are already available. What is other attribute which is required is interoperability. And I must tell you why interoperability is so important. Let's take an example of a teleconsultation. I'm speaking to you because you are all people from the health space and you are all familiar with these terms. Normally I would have given a generic bhashan which would not have meant much. But so basically, let's say a teleconsultation. Now there are multiple applications which have come in the country. Practo, 1mg, e-Sanjeevani, or maybe there are other things also I may not be aware of. Now the requirement of these is that the patient also has to have the same application as the doctor. So if doctor is on e-Sanjeevani, the patient also has got to be e-Sanjeevani. This is similar to when you are, let's say, buying something on Amazon. You have to have an Amazon application on your mobile to basically transact on an Amazon platform. That's the platform approach. Now we have gone beyond platform approach. We are going to what is called a network approach. Internet is a finest example of network, because internet you are able to connect disparate systems because they use the same protocol, underlying protocols. If for mail it is the SMTP, for other communications it is TCP/IP. There are many couple of protocols which are which are used. So what is happening is we are now, suppose if I have a 1 mg client, or I have, let's say, even what is called the Arogya Setu or any other client application, and the doctor may have e-Sanjeevani 1 mg Practo, if I could talk to him interoperably, then one need not have multiple applications on his device. If I have just, it's similar to, if UPI is one example, very right. Also, telecom world, again I want to give the example. If the Vodafone person could only talk to a Vodafone person, then this would have been a platform or a silo kind of approach. You could have balkanized the entire, sort of internet or whatever. Now, Vodafone fellow can talk to Airtel person without even knowing as to what is the brand of what is the network operator of the other fellow. This is the thing. So therefore, without bothering, if I have a teleconsult application and I can see the doctor which are available, whatever their platform can be, I could talk to them. Now this will actually give, this will be giving a order of magnitude larger numbers, and this will make things very, very easy. This is what we are doing in the digital health, Ayushman Bharat digital mission, whereby we are making everything interoperable. So this is what the people are doing in ONDC, Open Network for Digital Commerce, where we are saying it is not a platform approach, it's a network approach. So basically, if I have, let's say, a protocol and I want to see the doctors, whatever may be the other application the doctors may have, so long as they follow that protocol, I will be able to see them, and the doctors will be able to have their calendar. I could be able to make a booking to them. So I could search, I could book, I could fulfill. So I can search for ambulances, I can search for doctors, I can search for laboratories, search for health facilities. These are the basic attributes of the ABDM. We are making a couple of registries of health facilities, registry of health professionals, drug registry. These are authenticated registries whereby you could see that a person on this is a verified doctor, so he is not a quack, and you could test, when you do a teleconsult, you could verify that this person is a genuine doctor. So this gives a kind of confidence and trust. That is what we are building. Then you have the personal records. One should be able to build longitudinal health records. So we have what is called Ayushman Bharat Health Account. That is simply a number around which you could link all your records, and then they could be made visual and visualized. We are doing a small experiment in Lady Hardinge Medical College, and maybe you can go, some of you can go. What we are doing here is that there is a Ayushman Bharat Health account with a person. There is a QR code. The person does not have to stand in the line. He just goes there, he scans that QR code. His profile is transferred to the hospital's HMIS, and his OPD card is generated. So that way, without being in the line. So essentially, these are small trivial applications, but they are very important for a person who has to stand in the line at All India Institute of Medical Sciences. 4 a.m. he stands in the line, 12 p.m. he just gets out of it because he did not get his number. Again दूसरे दिन फिर आ जाता है बेचारा. तो ये छोटी छोटी चीज़ें हैं, बहुत महत्वपूर्ण है. उसी प्रकार से हेल्थ रिकॉर्ड्स आप अपने स्टोर कर सकते हैं अपने फ़ोन में, अपने डिजिटल लॉकर में. You can enable them. You have privacy fully done because nobody can access your health record without your permission. You can share your health record with your doctor. Then your diagnosis will be much better. Your cost will become less because every time you don't have to do X-ray or whatever diagnostic tests. So I think this is all happening. Now we have created 25 crore Ayushman Bharat health accounts. We all now starting a campaign whereby in schools, in colleges, in medical colleges, other institutions, we will be able to create health accounts for everybody. Immunization of children will be actually a part of the health account. We are repurposing COVID to become a universal immunization application, which means that usko polio drop lagaya to uska bhi record aa gaya, uska bhi he can have a certificate downloaded similar to the COVID certificate, COVID vaccination certificate. So all this is happening. Blood banks will also be on the same network. So we are creating a network which will be able to subsume or cater for a large number of services. But what is required is actually Technology is all done, friends, believe me, and technology is scalable, I can guarantee that. It preserves privacy. It is absolutely, flawless in that sense of the term. However, what is important is this is a project which is a very difficult project. I did Aadhaar, and I find that Aadhaar was an order of magnitude simpler than this project. Why? It was simpler because there were only two people, two entities, two stakeholders. One were the people of this country who wanted a digital identity. Free of cost it was being given to them. Other was the government who was giving identity to them. So people were enrolling in rolls, there were lines, and we had to have lathi charge in some places where there were too many fellows, and the fellow could not enroll so many people. Here the stakeholders are, patient of course is the central part, but you have doctors, you have facilities, you have laboratories, you have all kinds of institutions, homeopathy, Ayurvedic, all professional institutions. So you have pharmacies. So many people are there, and everybody's interests are not necessarily aligned. Some people feel कि मैं ज़्यादा डिजिटल करने लगूंगा तो इनकम टैक्स वाला आकर के मेरा पकड़ लेगा मुझे. तो there are all kinds of issues. GST हुआ तो everybody started कि भाई तो business डूब गया हमारा, because अब now I can't do any hanky panky. So basically all these things are there. But let us understand, we can have a little bit of small sacrifices for a larger public good. And I think if we can do it, if India can do it, I think it will be really transformational. Because let me tell you, wherever it has been done thus far, Europe and America, it has been done in an absolutely wrong way. In sense, America, you have Cerner, you have, I don't know, another company, Epic or something. Epic and Cerner, these guys control about 80 to 90% of the records, the health records. Now, that's not the way to do it, bhai. It should be completely democratic. It should be completely mobile, interoperable. So that's the way it should be. So basically, from World Go, we have started on a journey which is a very clean architecture. So we have an advantage, having begun late, I think, or beginning on a clean slate, we have an advantage, and I think that advantage should give rise. And I think we can do things at a scale, and we will do things completely differently. One of the aspects of doing things in India is frugality. India is an extremely cost sensitive market. If you say मैं 5 रुपये आपसे लूँगा, मैं नहीं दूँगा आपको. UPI में अगर मान लीजिए मुझसे कोई कहे कि 100 रुपया ट्रांसफर करने के लिए 2 रुपये का टैक्स लगेगा या कमी होगी, मैं कहूँगा भैया मैं जाके दे आऊँगा उसको 100 रुपये चेक कर. This is true. So therefore you have to have frugality built into the system. The system, Aadhaar जैसे कार्ड की, UK's ID card was costing 135 British pounds per card. India's Aadhaar has cost less than 100 rupees per Aadhaar. The total money spent thus far is less than 10,000 crores. We have issued 130 crore Aadhaars. So basically frugality, we have to understand, we are a poor country, why we can't afford to have very, very costly infrastructure. We are using completely, commodity hardware. लोगों ने उस समय आधार बना के कहा भाई बढ़िया हम आपको एक स्पेशलाइज्ड हार्डवेयर दे देंगे. तो हमने कहा भाई साहब आप दे दीजिएगा स्पेशलाइज्ड हार्डवेयर, बट देन आई विल बी मैरिड टू दैट ब्लडी हार्डवेयर थ्रू ऑफ माय लाइफ. द वेंडर लॉक इन हो जाएगा भाई. तो आई डोंट वांट वेंडर लॉक इन. So basically we are very clear as to what our objectives are. And once you are very clear in your objective, once you are very clear about your architecture from the word go, I think things will succeed. But this time around, things will succeed only when all of you become a partner into that process. And today I want to urge all of you who are influence maker, you are the opinion makers in your sector, to basically come together and actually make this digital health journey a successful journey. Thank you so much.